Hello, my dear travelers. Welcome back to the channel. It's always a privilege to have you here. If you're new, pull up a seat and settle in. I'm Mila, and I've been a flight attendant for over 15 years, spending thousands of hours at 35,000 feet, looking after millions of passengers. I've witnessed unforgettable moments, births mid-flight, tearful reunions, breathtaking proposals, and the sheer joy that travel brings. But I've also seen the other side, the medical emergencies, sudden diversions, and the raw panic in someone's eyes when their partner stops responding mid-flight. The hardest part of my job is knowing that many of these emergencies were entirely preventable. Often they involve sweet, stubborn seniors who, despite warning signs from their own bodies, choose to fly because they don't want to miss a trip or lose their money. Today, we're going to have a very honest but necessary conversation. The 5 signs you should never fly, especially if you're over 70. Now, I know what some of you might be thinking. Mila, don't tell me I can't travel. I'm 75 and I feel great. To you, I say that's wonderful. I want you to travel, to explore, to sip your ginger ale en route to Paris. But our bodies respond differently to the pressurized cabin environment as we age. Airplanes don't pressurize to sea level. They're more like being on a mountain at 6,000 to 8,000 feet. That shift causes gases in the body to expand, oxygen saturation to drop, and heart rate to rise. For a healthy 30-year-old, it's barely noticeable. For someone with underlying conditions, it can be dangerous. Take recent surgeries as an example. Eye surgeries like retinal repairs with gas bubbles can become catastrophic if flown on too soon. The gas expands and can permanently damage vision. Laparoscopic procedures leave residual air in the abdomen, which can cause extreme pain or internal injury at altitude. Even minor dental work, like a root canal, can create trapped air that mimics a stroke when pressure changes. One gentleman in his late 60s learned this the hard way after eye surgery. 20 minutes after takeoff, he was in severe pain, and despite our efforts, he lost significant vision. These are all preventable tragedies. If you've had any surgery in the last 2 weeks, from eyes to abdominal procedures to dental work, you must check with your surgeon before flying. Ask explicitly, is it safe for me to fly in a pressurized cabin? If they hesitate, do not board. Next, we'll cover sign number 2, the warning signs for respiratory distress and low oxygen levels, especially critical for passengers with COPD, emphysema, or pneumonia recovery. This one is deceptively simple to test at home. So, let's dive into sign number 2, resting breathlessness and low oxygen saturation. This is especially important for anyone with lung conditions, COPD, emphysema, pulmonary fibrosis, or those recovering from pneumonia or bronchitis. Here's a simple test you can do at home, something I call the Mila breathing check. Walk 50 yards briskly, roughly halfway down a football field, or climb 1 flight of stairs without stopping to catch your breath. If you're wheezing, gasping, or needing frequent breaks, that's a red flag. Your body is already struggling to get enough oxygen at sea level. Now imagine adding the cabin pressure at 8,000 feet. At cruising altitude, a healthy person's oxygen saturation might drop by 4% to 10%. If your baseline is already low, say 92%, you can quickly drop into the 80s. This condition, known as hypoxia, starves your brain and vital organs of oxygen. Your heart compensates by pumping harder, increasing strain and risk. I've seen seniors who felt mostly recovered from a respiratory illness board a plane, only to turn gray, with blue lips and confusion setting in just an hour into the flight. Emergency oxygen becomes a lifeline, but it's limited, and the yellow masks are for decompression emergencies, not chronic lung conditions. If you're over 70 with a known respiratory problem, get a pulse oximeter, just $20 at the pharmacy, and measure your resting oxygen. Below 92%, you need a fit-to-fly evaluation from your doctor, which likely includes a plan for supplemental oxygen or medical clearance. Flying with compromised lungs is like running a marathon through a straw. It's dangerous, but it's avoidable. Sign number 3 is unstable cardiac symptoms, the silent warning. Heart attacks are the leading cause of flight diversions, and many occur in people who felt fine that morning. Chronic, stable heart conditions are usually okay with doctor clearance. But unstable angina, chest pain at rest, or with minimal exertion is a strict no-fly condition. Even mild new chest tightness is a red flag. Combine that with the airport stress, long lines, heavy luggage, cortisol spikes, and the reduced cabin oxygen, and you have the perfect storm for a cardiac event. I remember a flight from New York to London where a passenger in her 70s called me over because her husband complained of mild chest discomfort. She assumed it was indigestion, but it was a heart attack. 3 hours over the Atlantic, no immediate access to a hospital, and we had to initiate CPR and divert to Newfoundland. A situation like that is terrifying, stressful, and completely avoidable. If you experience new chest pain, severe shortness of breath at rest, or recent changes to heart medication, do not board. The airplane is not a hospital. Defibrillators and basic drugs are not sufficient if your heart suddenly fails. Sign number 4, recent head trauma or concussion. Seniors often dismiss minor falls or bumps, thinking, it's just a headache, I can manage. But concussions involve brain swelling, and the cabin environment can exacerbate it. While the brain doesn't expand like a gas bubble, changes in oxygen and cabin pressure can worsen swelling and symptoms like dizziness, nausea, or light sensitivity. Even minor trauma in older adults can lead to slow bleeds, subdural hematomas, because the brain shrinks slightly with age, stretching the veins. At altitude, hypoxia causes blood vessels to dilate, increasing intracranial pressure. Flying too soon after a head injury can turn a manageable condition into a prolonged severe complication. If you feel dizzy, nauseous, or have a sudden severe headache, seek medical attention, not the departure gate. Finally, sign number 5, deep vein thrombosis, or DVT, the hot leg. We often talk about preventing clots with leg movement on long flights, but what if you already have one? Seniors have slower circulation, higher clot risk, and immobility during flights can dislodge a clot, sending it to the lungs as a pulmonary embolism, which can be fatal. Watch for swelling, redness, tenderness, or heat in one leg. Persistent deep muscle pain that feels like a cramp but doesn't subside is also alarming. Those with a history of clots or recent hip-knee surgery must have strict medical clearance and anticoagulation management. Severe anemia can mimic similar risks as low hemoglobin limits oxygen delivery, compounding the low cabin oxygen effect. By understanding these first 5 signs, surgery recovery, low oxygen, cardiac instability, head trauma, and DVT, you can make life-saving decisions before stepping onto the plane. It's not about fear, it's about preparation, awareness, and knowing your limits. The 6th warning sign I want to cover is cognitive decline, and this one is crucial for older travelers and their caregivers. Cognitive changes, even mild memory loss, can escalate quickly at 30,000 feet. The cabin's lower oxygen level, combined with disruptions to routine and circadian rhythm, can exacerbate confusion, disorientation, or agitation. Many seniors experience sundowning, a worsening of cognitive symptoms in the evening, but on a plane, this can happen at any time. A senior who is usually forgetful at home may become combative, fearful, or attempt to open the aircraft door, thinking someone is intruding. Flying alone with early to moderate dementia is extremely unsafe. If you're a caregiver traveling with a loved one with cognitive issues, they must never fly alone, and you need a plan for support throughout the journey. Now, I know some of you might be thinking, Mila, does this mean I can never fly? Absolutely not. It means you need to verify your fitness to fly before booking. The Fit to Fly assessment is your ticket to safe travel. It's not a casual thumbs up from your doctor, it's a comprehensive evaluation. This includes checking oxygen levels, examining recent surgeries, reviewing current medications, and evaluating heart and lung function. Think of it as a pre-flight inspection for your body. This is not optional for seniors with any of the risks we've discussed. It's an essential step in protecting your life and your family's peace of mind. Here's another layer many travelers overlook: travel insurance loopholes. You might assume that if you fall ill mid-flight, your insurance will cover everything. Unfortunately, that's not always the case. Most policies have clauses regarding traveling against medical advice. If you knowingly fly with an unstable condition or shortly after surgery, insurers can deny claims, especially if a medical emergency occurs in the air. They may review your medical records, see the surgery date, or note your doctor's warnings, The financial risk is substantial. Diverting a flight due to a medical emergency can cost anywhere from $50,000 to $200,000 in fuel, landing fees, and passenger accommodations. An air ambulance for a critical senior returning home could cost $50,000 to $100,000 upfront. Flying against these medical warnings is literally gambling with your health and your life savings. The wait and see strategy is often the safest path. Many conditions are temporary. Eye surgery? Wait 4 weeks. Heart attack or major cardiac event? 6 weeks to 3 months. Respiratory infection? Wait until your oxygen saturation is consistently above 95% at rest. The Eiffel Tower will still be there next month, but your health might not if you rush it. Patience is a form of preparation, and preparation saves lives. I want to stress something that is both practical and protective. Seniors have built a lifetime of travel experiences. They understand airports, planes, and itineraries. But the body changes with age, and flying introduces stresses that can push even a fit senior past their limits. It's not a judgment of your abilities, it's science. Understanding these risks empowers you to make smarter decisions, to travel with confidence, and to enjoy your journey safely. Finally, let's talk about communication and advocacy. If you notice any subtle symptoms, leg pain, breathlessness, chest tightness, dizziness, listen to your body. Do not assume it will settle down in the air. Speak with your doctor, get the necessary tests, and if needed, postpone travel. If you are caring for a parent or grandparent over 70, share this information. Sometimes seniors ignore their own warnings, but they will often listen to a professional like me who has seen the consequences firsthand. Travel is meant to bring joy, adventure, and connection, but it must be done safely. By understanding cognitive decline, securing a fit-to-fly assessment, and respecting your body's limits, you dramatically reduce the risk of a medical emergency mid-flight. Your health, your safety, and your peace of mind depend on it. Now that we've covered the critical warning signs, it's time to focus on how to plan safely and protect yourself when flying over 70. Knowledge alone isn't enough. You need actionable steps. First, let's revisit the Fit to Fly assessment. This isn't a casual conversation with your doctor. It's a comprehensive check of your oxygen saturation, cardiovascular stability, surgical recovery, and respiratory function. Even if you feel fine, these evaluations provide a medical green light and may include guidance on using supplemental oxygen, medications adjustments, or delaying your trip. Airlines and travel insurance providers take this documentation seriously. Without it, you risk being denied boarding, or worse, having your claim denied if an emergency occurs. Let's talk about pre-flight preparation. Proper planning can prevent in-air emergencies and reduce stress. Make a checklist that includes your medications, recent lab results, and a doctor's note summarizing your current health status. If you are traveling with supplements, oxygen, or specialized medical devices, ensure they comply with airline regulations. Many seniors overlook portable oxygen concentrators. These devices can be life-saving for those with low baseline oxygen, but they must be approved by the airline, booked in advance, and fully charged. Remember, the emergency masks on the plane are for decompression events only. They do not sustain oxygen for chronic respiratory conditions. Another key point is monitoring your physical condition at home before flying. For anyone with respiratory issues, I recommend buying a pulse oximeter, a small, inexpensive device that clips on your finger. Measure your oxygen saturation at rest and after mild exertion, like walking across the house or climbing a flight of stairs. If your reading is below 92% at rest, you are at serious risk during flight. Do not ignore these numbers. Hypoxia at 8,000 feet cabin altitude can rapidly worsen underlying conditions and strain the heart. Speaking of the heart, cardiac vigilance is essential. If you have experienced unstable angina, a recent heart attack, or arrhythmias, flying without clearance is extremely dangerous. The combination of stress, adrenaline, and cabin hypoxia can trigger a cardiac event mid-air. I've personally seen diversions caused by seniors who ignored early warning signs. One gentleman experienced chest tightness that he attributed to nerves before boarding. Within an hour, he was in full-blown cardiac distress. We had to administer oxygen and medications while coordinating a diversion. It's harrowing for the patient, the family, and the crew, and entirely preventable. Now, let's discuss recent head injuries and concussions. Seniors may downplay bumps, slips, or minor trauma, thinking it's no big deal. but any cranial injury can worsen under pressure changes. Low oxygen levels and changes in cabin pressure can exacerbate brain swelling or trigger bleeding, especially for those with age-related cerebral changes. Even minor dizziness, nausea, or confusion after a fall should prompt a medical evaluation before considering air travel. Deep vein thrombosis, DVT, and circulation issues are another silent hazard. Seniors, especially those with recent hip or knee surgeries, a history of clotting, or limited mobility, are highly susceptible. A clot can travel to the lungs mid-flight, causing a pulmonary embolism, which can be instantly fatal. Watch for swelling, tenderness, or redness in the calves. If any of these signs appear, do not fly. Hospital evaluation and possible blood-thinning treatments are mandatory before you consider boarding a plane. Lastly, consider cognitive decline. Even mild dementia or early-stage Alzheimer's can turn a routine flight into a crisis. The low oxygen environment can trigger confusion, aggression, or disorientation, and caregivers must ensure supervision. Seniors with recent episodes of wandering or severe confusion should absolutely not travel alone. Mila's rule of thumb: if any of these conditions apply to you, or you notice subtle warning signs, pause your travel plans. Ask your doctor for guidance, obtain a fit-to-fly assessment, and consider delaying the trip. Health always comes first. The Eiffel Tower, the Louvre, and your bucket list trips will still be there when it's safe. Even with the right precautions, there's another layer that many seniors overlook: travel insurance and financial risk. Many people assume that because they have a policy, they're automatically covered. But the reality is more complicated. Most travel insurance policies include clauses about flying against medical advice. If you board a plane with a known unstable condition or after recent surgery without explicit clearance and a medical event occurs, the insurance company can deny your claim entirely. They'll review your medical records, your doctor's notes, and even the date of any procedures to determine if the incident could have been prevented. I've seen firsthand the staggering costs that can result when seniors ignore these warnings. A medical diversion on a long-haul flight can cost anywhere from $50,000 to $200,000, depending on fuel, landing fees, and passenger compensation. If an air ambulance or a private medical jet is needed to bring you home safely, that can easily be an additional $50,000 to $100,000 upfront. Boarding a plane in poor health isn't just risky, it's potentially catastrophic financially. The key is the wait-and-see strategy. Most health concerns aren't permanent barriers, they're temporary. Recovery times are predictable. Eye surgery, wait 4 weeks. Heart attack, wait 6 weeks to 3 months. Pneumonia, wait until your resting oxygen reaches 95%. Your health is the top priority, and delaying a trip by a few weeks could prevent a life-threatening event. Remember, the Eiffel Tower won't disappear overnight, but your well-being is irreplaceable. I want to emphasize the responsibility of caregivers, family members, and friends. If you know a senior planning a trip, sometimes they ignore their own instincts or medical advice. Forward this information to them. A trusted voice, like that of a flight attendant who has witnessed these emergencies, can make a difference. Ultimately, the message is simple: listen to your body. If you notice shortness of breath, chest discomfort, dizziness, swelling, or any unusual symptoms, do not dismiss them. Take the precautionary steps, visit your doctor, undergo testing, and follow professional guidance before committing to air travel. Travel can remain a source of joy, connection, and adventure, but only when approached safely. Protect your life, your family, and your finances by respecting these medical realities. Being a responsible traveler means knowing your limits, preparing thoroughly, and making smart decisions. The skies will always be there when you are ready and healthy to fly. As we wrap up, I want to leave you with a perspective that balances caution with the joy of travel. Flying isn't off-limits simply because you're over 70. It's about knowing your body, respecting its signals, and planning wisely. The goal isn't fear, it's empowerment. By paying attention to the signs we've covered, you can continue to explore the world safely, without putting yourself, your loved ones, or your finances at risk. One practical step is to schedule a fit-to-fly assessment before any trip. This goes beyond a casual checkup. It includes evaluating your oxygen levels, reviewing recent surgeries, examining your heart health, and confirming your medications. Ask your doctor specific questions. Is it safe for me to fly at 8,000 feet? Should I arrange supplemental oxygen? Are there any recent procedures I need to be concerned about? Having a written clearance can be a lifesaver if questions arise at the airport. Next, listen to your body every step of the way. That slight shortness of breath on a walk, that dull ache in your chest, or even minor dizziness isn't trivial. It's your body signaling limits. Ignoring these signals might seem like bravery, but it's unnecessary risk. Delay your trip if needed. The landmarks you want to see, the flights you've dreamed of, will still be there in a few weeks. Caregivers and family members play a crucial role too. Speak openly with your loved ones about your health status and travel plans. Include them in the discussion, share your doctor's advice, and make joint decisions about whether travel is safe. Sometimes seniors won't heed their own caution, but a trusted voice can make all the difference. Finally, remember that travel is about creating memories, not testing limits. Flying safely allows you to fully enjoy your destination without emergency diversions, hospital visits, or unexpected medical bills. Follow the signs, respect your body, and you can continue to experience the wonder of travel with peace of mind. I want you to visualize the perfect flight, sipping a beverage, looking out the window, smiling, knowing your body is safe, your health is stable, and your loved ones are secure. That's the feeling I want every senior traveler to carry with them. You've worked hard, saved diligently, and earned these adventures. Treat your health as your most valuable passport. Stay smart, stay safe, and fly only when your body is truly ready. The skies will always be waiting, and the world is still yours to explore, carefully, confidently, and joyfully. I'm Mila, your flight attendant guide, reminding you that safe travel is not just about the destination, it's about arriving there in the best condition possible. Take care, listen to your body, and I'll see you in the skies.